Hi there. Did you know that you could have breast augmentation and be out to dinner the very same night after surgery? And did you know that we can get you back to most regular activities the very same day? Watch this video till the very end and I will tell you how. Dr. Tebbets is a plastic surgeon in Dallas, Texas, who developed this technique in January 2002, and I went all the way to Dallas to learn how to do this myself. So I'm Dr. Kara. I'm a plastic surgeon. I've been doing this for over 25 years, and I've treated thousands of very happy patients. I got a gold medal in surgery. I did my plastic surgery training in Toronto and went to Western for the residency program. So this shows a snow woman with breast implants, and you can get the fake look if you want, and some people really like it, and I'll tell you how that occurs. This shows the incision locations in a cartoon. You can have the incision around the nipple and the underarm or under the breast. The best place to put the incision is underneath, and this is also shown to have a lower risk in terms of capsular contracture and placement. This diagram shows the breast implant on the left in front of the muscle and on the right behind the muscle. And this is a cross section, and you can see the ribs and the nipple with the glands, and the implant looks more natural under the muscle, but some people really love the fake look, and if you have a lot of droopiness, you might actually need the implant in front of the muscle to fill out the tissues. So implants can traditionally be gel or saline. Most people like gel implants, and they find that saline implants can rupture and go flat on you. The implants are mostly round now. Shaped implants were usually textured, which have been banned. So most implants are now smooth surfaced, and that's what we uniformly use. In terms of the surgery, the risks can be bleeding or infection. There could be capsular contracture, which is firmness, and I do things to prevent that. We also give you antibiotics for dental appointments. Bacteria can get in at the time of a dental cleaning and create capsular contracture by spreading through your bloodstream, so you take a dose of antibiotic before and after your dental appointment. The implant can go downwards or to the sides because of gravity, and you can have unevenness, and I do things to help this and prevent it. We can have sensation changes in the nipple or the breast, and usually that settles with time. It's usually related to a nerve that gets pinched. ALCL is a lymphoma associated with textured implants that are now no longer available. Breast implant illness is a very vague, unknown quantity. It seems to be present mostly on the internet, and I've seen a couple of cases. I removed their implants and they felt better. It is not well understood and extremely rare. The implant may rupture. It may not last for a lifetime, and this has not been a problem for a lot of people. The companies now that make implants give you a lifetime warranty to have them replaced. You may not even notice that it's broken, and it's not it's not necessarily something that you would absolutely need to remove or change, but it's definitely an option. You may feel the rippling or the edges of the implant, and this is normal, and sometimes you can add a bit of fat. Rippling and feeling the edges is more likely on the side of the implant and underneath, and with most implants under the muscle or half and half, you don't usually see the edges of the implant in the middle or up at the top. Breast implants do not cause any diseases or cancer. There could be a risk of missing a future breast cancer on a mammogram. God forbid if you got a breast cancer and on a screening mammogram the implant may conceal a calcium deposit that's not yet a lump. Some people also do MRIs instead of mammograms, but there still is a risk of less than 1% of missing a breast cancer. So the implant may settle with time and gravity out to the side, and we encourage you to wear good support 24/7. We have recommended bras that you can consider. You can also add Galaform mesh, and we'll show you what that looks like. It's an optional underwire support that can make your tissues 4 times stronger. It's important to know that breast implants fill the breast, but they don't necessarily lift it. And I absolutely will do my best and always do my best in every case, but results may vary. And I guarantee my performance. I can't guarantee the results. So here's a picture of how a breast implant can fill a sagging breast, and usually the implant goes in front of the muscle in these cases to push the nipple up and forward. You imagine that the nipple is like a child on a swing, and the implant causes the nipple to rotate up and forward. Our surgery is done in a private in-hospital facility, and this gives a lot of people peace of mind. You're not going to a place on Yonge Street, Avenue Road, or to a hotel, and we definitely put your safety first. And we're also taking all the COVID-19 precautions, and an example of that is that we actually use ultraviolet light air cleaning, which cleans the air every 15 minutes. Or less, and this way we protect you from the viruses, and we can tell you a lot more about that. This is an actual patient that had her surgery in Miami, and it shows her blow drying her hair 3 hours after surgery, out to dinner 4 hours after surgery, out shopping 5 hours, and almost 6 hours after surgery she's partying in South Beach in Miami. So we get most people this kind of a result, and their experience has been excellent. So how do I do this? It's a precise electrocautery dissection. There's minimal bleeding. Usually most people have no bruising. There's no special dressings or drainage tubes. And most people don't even need any painkillers except for Advil. Women who've had kids tell me it felt like their milk was coming in after having the baby, and I jokingly tell them that I've never had that feeling, but I imagine it could not be too bad. So we'd love to see you, and if we're seeing you already and you're watching this video, we'd be very happy to have other patients who can talk to you to tell you about their experience. We have low monthly payments, and let us know if you have any questions. And a little bit of humor, this is the difference between men and women when they look in the mirror. Thanks very much for watching this video, and we'll see you soon. Bye.